Well, good afternoon and welcome to today's Breast Cancer Awareness Month webinar brought to you by BreastScreen Eastern Sydney Illawarra. My name is Dr. Nikki Theocaris and I'm the Clinical Coordinator of the BreastScreen Eastern Sydney Illawarra service. I would like to acknowledge the Bidjigal people who are the traditional custodians on whose lands I'm on today, and I acknowledge the traditional custodians of the lands of where you are joining me from today. We pay our respects to elders past, present, and those of the future. I would also like to acknowledge and welcome any Aboriginal staff present for today's webinar. This is the fourth webinar in a series of 5 webinars being provided during Breast Cancer Awareness Month. All webinars in the series will be recorded and will be accessible from the BreastScreen Eastern Sydney intranet page. Today's webinar is titled, What Happens at a Breast Screen Assessment Clinic? We will look at what happens when a client is recalled for further investigations following the screening mammogram and the role of the assessment team throughout the process. Before I hand over to the presenters, just some housekeeping to go through. We will hold questions until the end of the presentation. If you would like to post your question in the chat, feel free to do so. Your cameras and microphones are turned off for the webinar. Feel free to use the icon on top of your screen to post reactions. Today, we have our nurse manager, Lauren Harmon, and clinical nurse specialist, Lauren Gillard, to present the webinar on what happens at a breast screen assessment clinic. It is now my pleasure to hand over to them for today's presentation.
Thank you, Nikki. Well, welcome everyone to our webinar today on what happens at an assessment clinic when a client has been recalled for further tests. Our webinar discusses the BreastScreen New South Wales program, screening and result process within BreastScreen New South Wales, what is involved when someone is recalled for further tests, and the outcome following those further tests. BreastScreen New South Wales is a population-based screening program that provides free breast screening mammograms to women throughout New South Wales. Our service aims to improve the survival rate of women with breast cancer through early detection. Clients aged between 50 to 74 are invited to have a free breast screen every 2 years, and women aged between 40 and 49 and over 75 are also welcome to attend. The BreastScreen New South Wales Coordination Unit is managed by the Cancer Institute New South Wales with over 250 locations across New South Wales, managed within 10 local health districts. BreastScreen Southeastern Sydney Illawarra geographically covers both the Southeastern Sydney Illawarra and also the Illawarra Shellhaven local health districts, and we provide services to clients from Sydney Harbour to just north of Batemans Bay at Durras.
The screening mammogram with BreastScreen New South Wales is always performed by a female radiographer, takes 20 minutes and requires no referral and is free of charge. Usually we'll only take 4 mammograms, and typically from the top of the breast through to the bottom of the breast, the craniocaudal view or the CC view or the mediolateral view, or commonly referred to as the MLO view. Screening mammogram results are obtained after the images are reviewed by a minimum of 2 specially trained doctors. Each mammogram image is read independently and consensus must be achieved between the first and the second doctor. If consensus can't be achieved, a third doctor is required to review the images. The recommendation of the third doctor will then provide the outcome of screening. Results are typically available within 14 days, and there are 2 main result outcomes that can be given. The first result outcome is that the client can return to routine rescreening as no evidence of breast cancer has been found. And our second screening result outcome requires that the client return to an assessment clinic for further tests.
Around 1 in 20 clients will be recalled for further tests each year to an assessment clinic. Appointments are usually offered within 28 days from the date of the screening mammogram and are offered and these ladies are offered an appointment at one of 3 of our assessment sites. These sites are at the Royal Hospital for Women at Randwick, St George Hospital at Cogra, and Crown Street in Wollongong. When we recall a client for further tests, they're contacted by one of our nurse counsellors, such as myself, who will explain the assessment process to them, including the imaging procedures that will be performed on the day and the possibility that a biopsy may also be required. Contacting the clients directly allows them to ask any questions they may have and ensure the client is informed about the reason for the recall in hope of also decreasing their anxiety. We advise clients to allow between 2 to 4 hours for their appointment. However, we do recommend that they will be available for the entire day just due to the unpredictable nature of an assessment clinic. We encourage clients to also bring a support person with them and any extra material that they may want to use to keep themselves busy during the waiting times between the tests. Clients are also advised that fasting is actually not required. And we also remind clients that things such as deodorant, talcum powder, and body lotion should not be worn, as this can actually produce artifacts that potentially interfere with a mammogram image.
When a client attends an assessment clinic within our service, their management and investigations are based on the triple test. The triple test in regards to breast symptoms, breast imaging, is the most accurate way to detect breast cancer and includes a clinical breast examination, breast imaging with a 3D mammogram and an ultrasound, or breast biopsy if required. When a client attends an assessment clinic, it is important that they feel supported and are given the appropriate amount of information. When a client arrives to an assessment clinic with their support person, they are welcomed by one of our nurse counsellors, and the process of the assessment clinic visit is then explained to them. And this then enables clients to be able to ask any questions they might have about the assessment. Consent for assessment discussion with the client involves confirmation of their details, including their full name and their date of birth, their general practitioner with whom they want their results to be forwarded to. We often need to confirm this because sometimes there's some, errors with the GPs. We have to obtain their consent to see if they're happy for the results to be sent through to the GP. And it's also important to check if there's any other healthcare providers, such as an Aboriginal healthcare worker, that they might prefer their results go through to. We explain the reason for the recall, the tests that may be carried out during the appointment, and we also ask if the client has any past breast history or any symptoms. We also check if the client is taking any medications such as anticoagulation therapy or if there are any allergies. And then we need to complete the formal consent process, which involves reading together the consent form for assessment and then obtaining the client's signature. We always tell clients in this initial conversation that if the tests are normal, the client will be able to return to routine screening and no further testing will be required. If the clients are always encouraged to ask us questions before signing their consent form and are reminded that they have the right to withdraw consent at any stage. If we aren't able to get a return to routine screening result, we may need to do a biopsy. We'll also let the client know that that will happen on the day.
The first diagnostic investigations performed during that assessment clinic is a 3D mammogram. The 3D mammogram provides a more detailed image of the breast than a standard 2D mammogram performed at the screening. During a 3D mammogram, also known as a tomosynthesis, an X-ray tube is passed over the breast in an arc, taking multiple images from various angles, which are then collated to produce a detailed 3D image, resulting in hundreds of images as opposed to only the 2D image taken. The second diagnostic test performed at an ultrasound clinic is at the assessment clinic is a breast ultrasound. Ultrasounds send high-frequency sound waves towards breast tissue while receiving these waves that are echoed or bounced back. The image of the breast tissue are created by these reflected sound waves, which are dependent on the internal structure of the breast, such as the boundaries between fluid and soft tissue or between bone and soft tissue. Benign lesions on ultrasound are commonly well circumscribed, hypoechoic, so brighter than the surrounding tissue, wider than deep, and they have a smooth appearance to them. Equivocal or malignant lesions tend to have a spiculated or an angled margins, a hypoechoic, which is darker than the tissue it is being compared to, and they are usually taller than it is wide.
After imaging, and if it's determined that the client requires a biopsy, a clinical breast exam should be performed. A clinical breast examination is a physical examination of the breast performed by a breast surgeon to look for any lumps, breast changes, or abnormalities. Clinical breast exams that are conducted by trained professionals often pick up breast changes that the client may not have picked up themselves. When performing a clinical breast examination, visually, a doctor will look for any changes or differences in the shape of the breast, any areas of fullness or thickness in the breast, any changes in skin colour, such as redness, any texture changes, any visible lumps or swelling of the skin, temperature, if the breast is warmer in one area, any nipple discharge or fluid, or any changes to the nipple, such as inversion where the nipple begins to point inwards on itself. After visually examining the breasts and the nipples, the client is then asked to lie down so that the breast tissue flattens over the chest wall. The area is then palpated, and this area includes the middle of the chest into the armpit, upwards towards the collarbone, and up into the axilla. Findings on palpation can include breast lumps, which indicates their size and their shape and whether they move within the tissue, any hardening or thickening of the breast tissue, or any tenderness or pain.
Clients who require a needle biopsy need to be appropriately provided with information, and nurse counsellors will adjust the amount of information given and the way it is delivered, tailoring to the individual clients. Things we take into consideration including is in their demeanour, their level of understanding, and demographics are all considered when discussing a biopsy procedure with our clients. Consenting for biopsy includes ensuring that clients understand all the options available to them and the expected outcomes, such as the benefits and risks associated with having a biopsy. Clients are provided with both verbal and written evidence-based information, and this includes things such as why a biopsy is required, the type of biopsy that we need to do, what is expected during a biopsy, possible complications of a biopsy, aftercare, such as analgesia, ice packs, and compression, what they should do if concerned or if help is needed after the biopsy or when they've gone home, when they are to return for their biopsy results, and who they'll get those results from and the location of where those results will be delivered, and contact details of the nurse counsellor as well. The client is offered a chance to discuss any questions that they may have, and when the client is satisfied they have appropriately understood that procedure, then they sign the consent form for that biopsy.
We perform two types of biopsies, or two main biopsies here at BreastScreen. The first biopsy we perform is an ultrasound guided core biopsy, and that is for lesions that are visible on ultrasound. This slide shows an ultrasound guided core biopsy sample. Our ultrasound guided core biopsies are very useful on solid lesions. The second type of biopsy performed during an assessment clinic involves the use of our mammogram machine and is necessary for those lesions that we can only see on mammogram, such as calcifications, or if we need to remove a larger sample of tissue. This slide shows the tissue sample difference between our ultrasound guided core and our tomosynthesis guided vacuum biopsy. You can see that the vacuum assisted biopsy with tomosynthesis takes a larger amount of tissue. We will also take an X-ray of the sample if we are biopsying calcifications, and this ensures us that we've taken a good sample of calcium. At the time of a biopsy, one of our radiologists may make the decision to insert a tissue marker clip. We insert clips because this enables us to monitor the lesion either on further imaging, or it allows the lesion to be precisely targeted at surgery. Marker clips come in different shapes to allow differentiation of multiple lesions sampled.
A mammogram is also completed after we've inserted that clip, just to ensure that that clip or that tissue marker is in the correct position. The outcome of a biopsy is usually given within 7 days and can include a benign result, equivocal, a further assessment, or treatment. So a benign outcome indicates that no abnormalities or evidence of cancer have been identified and the client's able to return to their routine screening. An equivocal result can indicate the possibility of a high risk or an underlying malignancy that requires a further assessment, either by repeating an image later, performing a further core biopsy to obtain further tissue samples, or doing what we call a diagnostic open biopsy, which requires admission to a hospital for a larger biopsy to be performed under a general anaesthetic. And this is done by one of our breast surgeons. If a biopsy does show a malignancy, either an invasive malignancy or a non-invasive malignancy, this treatment is obviously recommended, and it includes usually surgery, sometimes chemotherapy and/or radiotherapy as well.
Clients who are given a treatment outcome following an assessment clinic are given results by one of our breast surgeon, and one of the nurse counsellors is typically always present as well. A client can also choose to have their results given by their GP if they prefer. Clients are always given a copy of their pathology results, a BreastScreen assessment outcome report, which contains imaging information and also pathology information. We also give written information from Cancer Council Australia and the Breast Cancer Network of Australia to the client. This written information provides information about breast cancer diagnosis, treatment options available, benefits of treatment, any adverse effects of treatments, and most importantly, it allows them to be able to access external support services if they need it. These resources are really great. They're available in lots of different languages. Copies of results are also sent to the client's nominated GP or healthcare worker, and we also do a written referral to our breast care nurses, our local breast care nurses that work within our local health district. Following a treatment outcome, clients are returned or asked to return to the care of their GP, and they are then excluded from our BreastScreen program for a minimum of 5 years. This allows them to have time to complete their treatments and also have appropriate screening with their treating team. Nurse counsellors will always reach out to clients approximately 2 months following the assessment, and that's to make sure that their treatment is going okay, that they're being managed, correctly, or that they are having treatment, as is sometimes the case. Surgical results are also chased up, and this enables us to be able to correlate with the assessment results, and it just makes sure that optimal health outcomes are obtained.
Thank you both for the wonderful presentation. It really gives us insight into the management of women recalled for assessment following the screening mammogram. I'm not sure if there are any questions in the chat. Thank you all for attending. It is really great to see such a range of staff attend. Thank you.